Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. I am Dr. Sikander, Associate Professor, Head of the Department of Rehabilitation Sciences, Faculty of Allied Health Sciences, University of Lahore. Today we will discuss the adult neurological disorder, especially the causes of adult neurological disorders. As you know that there is the multiple causes of the adult neurological disorder, in which the most common cause of this disorder is stroke. Stroke, or we are also called it CVA. Stroke in which the blood supply of the brain is compromised, or the blood supply of the brain is compromised into the two manner. One, the blood supply is blocked due to the thrombus and the atherosclerosis, and other is the blood supply is blocked due to the rupture of the artery. When the artery is ruptured, they will not supply the proper blood to the brain or a specific area of the brain, which cause the adult neurological disorder, especially aphasia. The causes of the aphasia is divided into the multiple factors and the causes. First one is the hemorrhagic, second one stroke is the ischemic stroke. Then ischemic stroke, another type of the stroke is transient ischemic stroke, which will regain their blood supply after some time. Then further we will divide the occlusion or the stroke of due to the ischemia into the occlusion of the blood vessel, or interior blood vessel or the posterior blood vessels. And the hemorrhagic stroke are further divided into the subarachnoid hemorrhages and intracranial hemorrhages. As you see that the thrombosis is one of the most common cause of occlusion of the blood vessels. Thrombus, and second one is embolism. Embolism is the second one cause for the occlusion of the blood vessels. Then the occlusion occur into the interior circulation from which will say that it is due to the occlusion of the internal carotid artery. And the posterior circulation, which will call it the circulation due to the basilar artery and the vertebral artery. Then the subarachnoid hemorrhages is due to the aneurysm of the different arteries, and arteriovenous malformation is one of the common cause of the subarachnoid hemorrhages. Then the intracranial hemorrhage is due to the hypertension, and also the amyloid angiography, angioplasty is one of the most common cause of the intracranial hemorrhages. Then this is the interior circulation, which is derived from the most commonly the internal carotid artery, in which we include the anterior cerebral artery and the posterior cerebral artery. The most common area, which due to the damage of this area, the most common artery which causes the aphasia is middle cerebral artery. Then the middle cerebral artery is divided into the two parts. One of the middle cerebral artery is the superior division and the other is the inferior division. Due to the superior division, there is a Broca's aphasia, and due to the damage or the occlusion of the inferior division, they causes the Wernicke aphasia. Now this is the further division of the arteries of internal carotid artery and the vertebral artery. Internal carotid artery are further divided into the anterior cerebral, middle cerebral, posterior cerebral, tentacular arteries and posterior communication artery, and the ophthalmic artery. The most common cause of the occlusion of the middle cerebral artery, which is branch of the internal carotid artery, causes the damage to the area which is called the language development or causes the aphasia. So this is the figure that showing that the thrombus is traveling from the other side of the body and impact into the small arteries of the brain and causes the ischemic damage to the brain and causes aphasia. Then this is actually the fatty clot which block the major arteries. This is known that the middle cerebral artery or the internal carotid artery. When this dislodge from this area, this will cause the blockage to the minor artery into the brain as a emboli, travel as the emboli and causes the damage to the Wernicke or the Broca's area, which will cause the aphasia. Then this picture showing the hemorrhagic aphasia. In the hemorrhagic aphasia, the artery will rupture and the blood supply of the specific area will compromise and causes the aphasia. Then this diagram showing the artery which is blocked due to the thrombus and causes the ischemic stroke, which will ultimately cause the aphasia. Now the one most other common causes, and the most common cause of the aphasia is arteriovenous malformation. In the arteriovenous malformation, the bundle of the arteries and the veins are not normally developed. They are combined with each other and causes the bundle of the arteriovenous malformation. They will also cause the aphasia. Now the one disease, amyotrophic angiopathy, in which the amyloid protein is developed in the most of the arteries. In later ages, in a age after the 60 year, when the amyloid is deposited into the artery, they will block the multiple arteries, in which the one artery is middle cerebral artery or superior or inferior division of the middle cerebral artery, which cause the aphasia. Tumor are also the one of the cause, but not common cause, and tumor is developed from the different part of the body and then travel or implant into the brain, and that also cause the damage to the language area, and ultimately the aphasia of the different type of the aphasia occurred. Now the hydrocephalus when the cerebrospinal fluid which will generate into the ventricle and they drain into the subarachnoid space is blocked. That accumulation of the cerebrospinal fluid causes the blockage of the different arteries and pressure to the different areas of the brain. This pressure causes the necrosis or the ischemia of the brain. Then another cause of the aphasia is infection. This infection is due to the bacterial or the viral infection. Most common cause of the bacterial infection is the meningitis. Then meningitis is damage the area of the language and also causes the abscess of the area of the language. It means that the area of the 44 or the 22, which will cause the aphasia, different type of the aphasias. Now the toxemia. Toxemia, most of the heavy metal when we use in the environment, when we use it in the food, they accumulate, or in the form of the drug, they accumulate into the brain or arteries of the brain and causes the damage to the specific area of the brain, specifically the lead poisoning or the mercury poisoning, which will cause the damage to the language area and causes the different type of the aphasias. Now the metabolic and the nutritional deficiencies are one of the cause of aphasia, in which the thiamine deficiency are most commonly occurred due to the uses of the alcohol, and also the vitamin B12 deficiency are also cause the symptom like the aphasias. Thank you so much.